It's a pleasure to have Dr. Henry Oluwasefunmi Savage with us today. He's a consultant cardiologist, and we're going to talk about all things heart and heart related. So welcome, Dr. Henry.
Thank you very much, Dr. St John. Thanks for inviting me. It's an honor to contribute to this series.
Thank you so much. So I think what we could do is start with some quick fire definitions so everybody's clear. So we are going to be talking about heart disease, but I know that sometimes people talk about cardiovascular disease, blood pressure comes into it. So should we go through some definitions so everybody's clear? So should we talk about cardiovascular disease first?
Yeah, I think there's a lot of overlap with the definitions, but I think what patients and carers certainly want to have is clarity about what you're saying to them. So cardiovascular disease is a broad term that encompasses diseases that affect the heart and the vascular system. That's the vascular system in the body. Heart disease is a very broad term, and it encompasses a whole bunch of things, including cardiovascular disease. So you see, for this audience, and certainly for the topics that we're going to be talking about with diabetes, I think it's probably best to focus on using the term cardiovascular disease. Cardiovascular disease usually refers to conditions that will cause a buildup of fatty deposits inside the arteries that can cause the risk of what people would traditionally call blood clots. So an artery is a pipe. An artery is a plumbing pipe that carries blood to organs. An artery has got a diameter, so it's because it's a pipe. And if you build up or clog it up with various things, the diameter narrows. Now, those arteries where this sort of problem can happen can affect any organ in the body. So that's very important. The kidneys, the bowels, the heart, the brain. And so the term cardiovascular disease, because of the strong links of the pipes, so the arteries that carry blood to the heart and the arteries that carry blood away from the heart, often means that it's conjoined together in its terminology. Now, going back to what these fatty deposits within the arteries are, you will then hear the other term called atherosclerosis, which essentially means hardening of the arteries as a result of buildup of fatty tissue.
So thank you. So we've talked about cardiovascular disease as being an umbrella term, and encompassed within that, we have the various types of heart disease, which we'll go on to talk about later, and the vascular system being the circulation system, which you've described as a series of pipes of varying diameters. And sometimes I've really broken that down to big vessels and small vessels. And the big vessels, things like supplying things like the heart and the brain, and the small blood vessels supplying things like the eyes. So you describe those fatty deposits which can build up in those blood vessels of varying diameters. And sometimes, again, I used to describe that as, like the furring up of pipes that people can see sometimes with things like washing machines and so on. Those vessels of various diameters can get a bit furred up and clogged up by this atherosclerosis that can develop in the system. So that's cardiovascular disease, that big umbrella term encompassing those various things. And can we mention also blood pressure? Because I think blood pressure may fall under this category as well. Do you want to say a little bit about
Absolutely.
that as well?
Yeah. So, going back to the big or the medium or the smaller arteries, when you have this process, because fundamentally, this is the process that causes the problems or the clinical problems that a patient may have. So if you have your arteries getting furred up or clogged up, eventually they could harden, because what happens to the furring up and the clogging up is that it sort of just almost affects the shape of the vessel and the wall of the vessel and the walls become harder. Now, if you imagine that the heart has to pump through pipes, and if the arteries have become harder to pump through, you're going to generate higher pressures within those pipes. And that's just a simplistic way of describing it, but it's one I think that, basically puts it in perspective. If you've got those arteries that have become really hardened and difficult to push anything through, you're going to require quite high pressures. And that's where you have the term hypertension, high blood pressure. So that's a condition where a patient has a higher than normal blood pressure, and that is associated with lots of complications and pathology for patients.
And I think one of the things that people may not realise, but it's obvious when you think about it, is those blood vessels have to be elastic in order to be able to respond to the pumping of the heart. And so therefore stiffness is what causes the disease process, if I can call it that. So that stiffness is something that you don't want. You want elasticity in those blood vessels.
Yes, and which is one of the reasons why I've kind of moved away over the last, 10, 15 years from using the word furring up, because I think that there's some confusion where people think fur is naturally in your mind, you think is nice, soft, fluffy stuff. When you look at the arteries of a patient who has hypertension or who has developed cardiovascular disease, and you look at it on slides, it's not fur, it's hard cement like gunk, if you like, within the arteries. And so you're absolutely right. These arteries should be elastic. They should open and close depending on the situation in the body. But over time, they lose the ability to do that. They just become stiff, rigid, and hardened. And that's where the problem comes. But these are perfectly preventable problems.
Okay, so let's go on to talk a bit more about it. So we want to talk about diabetes and heart disease primarily, but we're going to touch on those other things as well. So can you tell us how the two things are related, diabetes and heart disease?
So for the audience, I'm going to say heart disease, again, a bit of an umbrella term, but what people will recognize when we say heart disease is, I like to break it down into the plumbing, which we've been talking about. So, the pipes that supply blood to the heart muscle, because you see, the heart is an organ too. The heart pumps blood, which is got lots of oxygen to all the organs in the body. So everybody is happy. Your brain, your kidneys, your liver, your muscles, everybody gets oxygen. But before it does that, it pumps blood through arteries that supply itself, so its own muscle. Now, just like every other artery in the body, the arteries that supply blood to the heart muscle can get clogged up. Now, if you clog up those arteries, they become narrower, less blood flows to the heart muscle, less oxygen flows to the heart muscle, and over time, the heart muscle could get damaged. Now, if the heart muscle gets damaged, you have your classic, a patient who has had a heart attack. The scientific term for that will be a myocardial infarction, but that person has had a heart attack, and as the arteries get narrow, what happens to the patient is they may start to realize that they're unable to exert themselves without getting symptoms in their chest. Hopefully, they get chest pain because they're more likely to report it, as opposed to breathlessness, and breathlessness in a woman, which is even worse because we know from all the data that women are less likely to report their symptoms and more likely to suffer complications from heart attacks. And so that's one aspect of heart disease. The concept that the arteries, which should be supplying blood to the heart muscle, become narrow, and over time there's damage to the heart muscle. Now, if there's damage to the heart muscle doesn't work as efficiently as it should. So, rather than pumping out blood as efficiently, it does so less efficiently. And I use the analogy. Imagine the heart, when it is full of blood, is 100 mils. In a person who has a completely functioning heart where there's no problems with it, every time it squeezes, it should always squeeze out just over half its contents. So 100 mils, if I squeeze out 60, I've got 40 left, and I go to 100 again, and happy days. The heart is working as strongly as it should. So we measure that function of the heart by the percentage of blood that is pumped out with each beat. So 100 mils, if I pump out 60 mils, I've pumped out 60%. So the normal functioning heart, by that measure of function, the ejection fraction, is around 50 to 60%. Anybody whose heart function is less than 50%, so 49%, 35%, or 5%, like I saw the other day, has got heart failure. So I've talked about a heart attack. I've talked about heart failure as a consequence, most times, of a heart attack. In some patients, there might be a genetic reason why their heart doesn't work as well. However, that's one consequence. And then the heart, for it to work, has got its electricity. So we've talked about the plumbing, we've talked about the pump, now the electricity. The electricity in the heart is so fine. It's so fine, and in terms of the way it's arranged, it's nothing like what my electrician did the other day to my garage, where you've got it all over the place. It is as designed by God. Or you've got nice wires that should not be touched. If you start to damage the muscle of the heart, you will damage the wiring of the heart. And if you damage the wiring of the heart, you start to get abnormal heart rhythms, so what we call arrhythmias. So for heart disease, you've got the plumbing, you've got the pump, you've got the electricity. How does diabetes contribute to all of these things? Well, the fundamental problem with diabetes, as many patients who are on here will know because they may have education about their condition, is the fact that there's a problem with the way the body handles glucose metabolism. Now, the several things happen between the fact that I can't handle glucose as well as I should and developing heart disease. But the primary pathophysiological problem, or the primary problem that happens within the heart, is the development of atherosclerosis. In many ways, that consequence of poor glucose metabolism leads to several issues that cascade into the production of excess fatty deposits within the arteries. In the heart, of course, there are many other areas where diabetes can affect, but we're talking about the heart now. And then you start a vicious cycle, because what happens is you have a almost 5 times higher risk of developing coronary artery disease. Coronary arteries are the arteries that supply blood to the heart muscle. Therefore, it's an exponential risk, a higher risk, therefore, of developing heart attacks. And if you develop a heart attack, you have a 5 times more chance of developing heart failure. And once that happens, you then have an almost 1 in 3 chance of developing an abnormal electrical problem or an arrhythmia within the heart. So that exactly is how diabetes works very closely with the development of heart disease.
I mean, that was beautifully explained. I mean, giving the different categories of heart disease and the reasons why you might develop them, and then also showing how diabetes can subsequently have an impact on those 3 different aspects as well. So you're saying that there is an increased risk of the various types of heart disease affecting the different aspects of the heart caused by that raised blood glucose. So I'm going to extrapolate from that. I don't want to put words into your mouth. If your diabetes is not where it should be, let's put it like that, yeah? Is that going to increase your risk of developing these conditions? What would you say?
Absolutely, Dr. St. John. Basically, one of the reasons why we have to be aggressive, I don't like that term, but we have to be intentional about treating diabetes properly and reaching, targets that are good for your patients, is because you want to stop the pathophysiological mechanisms that lead to the complications. So the development of heart disease is not it's not a fait accompli in a patient with diabetes. It never should be. The development of heart disease in a patient with diabetes is a complication of diabetes. And the reason why there's a complication is because of poor control. Now, if you control diabetes really intentionally, then you either kick the can down the road and keep kicking the can down the road for that patient to live the full length of their life without developing serious heart disease. Now, if you don't, it will happen earlier. And in fact, in patients who have poorly controlled diabetes, they have a higher risk of developing coronary artery disease or heart disease in general much earlier than a patient who has tighter control of their diabetes.